We have over 300 residents here at Piedmont Gardens, and on average we have about one fall a day. Staff injuries is a major concern in senior care, as falls are a major concern. So we're constantly needing to get residents up off the ground who maybe haven't really hurt themselves, but they need a lift. And that's where the IndeeLift comes in.
Our first impression was exciting. When we were doing an inspection of the factory and we walked by and my entire crew stopped, we said, what is that device that we see there on the floor? And we went and got the person that was giving us the tour and called him back and said, come tell us what this is, because we think we know what this is. It looks really exciting, but tell us what this is. It was just really neat because you see something and you go, I think that's for picking up people. And we called them and goes, oh yeah, and they're explaining how they lifted it. And we said, we need one of these.
My initial findings about the IndeeLift was that it worked exactly as it was supposed to work. And it lifted patients, residents up off the ground safely and efficiently without injuring staff. For me, the IndeeLift stands out when everything works as planned and no injury results. I'm always concerned about a staff injury from a fall.
The residents think of the IndeeLift as a better way and means of getting them off the floor with minimizing the injuries to the staff.
Using the IndeeLift prevents us from having to use our bodies and to be in difficult positions. We are able to use the device, have the patient slide right onto the device with very little assistance, and then IndeeLift picks them up to a great height and we can slide them right over to the gurney. One of the great things we've learned with the IndeeLift is we've been stacking our EMS patient equipment onto the IndeeLift. It's about 90 pounds of gear that we normally carry into a scene. Now we're putting it on the IndeeLift and wheeling it in and taking that weight and pressure off our backs.
I've been working here for 5 years at Piedmont Gardens. So when somebody falls, we usually just have another CNA to help us, so that's either a 2-person, 3-person assist, depending on how heavy the resident is.
A lot of the problems when lifting patients off the floor is we're in tight spaces a lot of times and we need to bend over. We can't get in that proper body lifting, which they always talk about. So you're twisting, you're torquing your body, and you are lifting. Even when you're in the proper position, you are putting strain on the lower back and your legs and your shoulders, and many people get injured. It's just a frequent and known injury.
Before IndeeLift, a staff injury to a staff nurse who's lifting a patient off the ground is very, very common and very costly.
Before IndeeLift, what we'd typically do is we'd go in and assess the patient, and when we needed to pick them up, we would either grab them by their clothing and try to pick them up, get under their arms, or we do have some belts we'd wrap around them, but we'd still need to bend over and lift them as an entire crew or several people around a person to lift them.
Fall recoveries, getting residents off the ground, commonly results in staff being injured. So we almost always have a nurse or a nursing assistant out with a back injury.
From the beginning, we've been working with Steve, designing the IndeeLift for EMS services. Steve has listened to our input. He likes to meet with us and call us and find out what our thoughts are, and then next thing you know, he's making a change, and it's been just a great working relationship with Steve.
Since we started using IndeeLift, it has been quicker and easier for us to take our residents off the floor.
The IndeeLift has been a great tool for us, for my crew and I. When we go in to lift patients up, we use the IndeeLift to lift the patient safely and easily, and we don't need to use our backs to do this.
The IndeeLift is the tool that you're going to need to safely get your residents up off the ground from a fall. You're going to prevent staff injuries, keep the nurses on the floor where you need them, and the residents up and walking.
Speaking to other firefighters, the #1 reason to use this is to save your backs. We all get injured. You want to have a long career, you want to have a full career, you need IndeeLift, and this is going to save you.